Today on the Transplant Helper, we're going to be talking about an extremely important indicator that your physician is possibly using on you in order to determine your quality of life, your well-being overall, your overall health, as well as the potential for morbidity. Yeah, that means death. We better talk about this one.
Hit the subscribe button and the bell notification to become part of the Transplant Helper community.
Hey folks, welcome back to the Transplant Helper again today. My name is Jim Merle, and just to jump right into it today we're talking all things concerning your HRV. Now, if you're not familiar with the term HRV, basically that means heart rate variability, and yes, as it sounds like, it has a lot to do with your heart rate. But not just your heart rate, not just your cardiac health, but it also has to do with your overall health, because if there's a problem with your HRV, there can in essence be problems with your entire body. You can become just a mess, okay? And it can put you at risk for so many other conditions, diseases / difficulties. I thought we should really sit down and talk about this. Anyway, nonetheless, HRV does concern your heart rate. However, it's not what I typically think about as heart rate. You know, whether or not you're beating 60, 70, 80, 90, maybe even if you're a transplant patient, especially in the beginning, 100 beats a minute or so, it is not just that. Now, you've probably been like I have. You've gone into your cardiologist for different visits, transplant related, is what my case is. But you go into your cardiologist, and one of the first and main tests they do on you, among a battery of tests, is something known as an EKG, lately been called an ECG. And when they do that test, I've thought so many times, you know, what good is this thing? They lay me back on a table, put about 12 leads or stickies all over me. They basically tell me to relax and be still for just a second or two. They hit one button, it spits out a paper, a 15-second test. They rip it off, hand it to you, take it to your doctor. That's at least your instruction. And I think to myself, you know, what can they possibly get out of this? Yeah, they're checking my heart rate. Yeah, they're looking for different things, but what could they possibly get out of this? Because for me, when I take that physical paper, and that's what they do over at UAB, they hand you the paper, I take it back out to the waiting room as I'm waiting on the doctor, and I look at it and I think, well, looks good to me because we've got 65 beats per minute or something like that. The beats themselves look to be very equal. You know, there's none that's really spiking up or dropping down. They seem to be spaced pretty close together and at about the right rhythm. Everything looks good to me. But sometimes, not all the times, my doctor will look at that and he will see so much more. And I'm not trying to tell you how to read an EKG. We may have a video on that later. There's a lot of detail in it, more than I realized. But I'm really just specifically talking about that heart rate variability. And that's not the variability between how it looks, you know, as it spikes on that reading. That is the variability between the beats. Again, I would assume a healthy heart is going to have exactly the same space between each beat, each beat, each beat. And on average, that's sort of kind of how it is. However, your heart does not and really should not be beating like, say, a metronome. You know that thing that you see sometimes when you're seeing someone in a band or in music, that metronome ticking back and forth, helping them to keep time or beat time for that music. And those things are always exactly, precisely consistent, and it helps them to stay on rhythm. Your heart should not be like that. Yes, the variability should be minimalized, but there should be a few millisecond, I said, variable between one heart rate and another. And I'm just making up numbers for illustration. This is not what it is. But if your heart, say, is beating 1 time per second, seemingly on average, then the space in between this beat and then this beat and then this beat should not be 1 second, 1 second, 1 second. It should be like 1.2 seconds, 1.4 seconds, 1.0 seconds, something like that. Milliseconds of difference. And that indicates there basically that your heart is doing exactly what it should and working along with your overall system known as the autonomic nervous system. And you're saying, Jim, what is the autonomic nervous system? Well, that has to do with things that your body kind of sort of automatically handles. It has to do with things that your body does consistently, and you don't have to think about it, and it moves on. And that system is divided, the autonomic nervous system is divided into 3 parts, 2 of them that matter in this, 1 being the sympathetic nervous system, and 2 being the parasympathetic nervous system. And what happens in that nervous system, that basically tells your heart or commands your heart to beat in a certain pattern, in a certain way. And if you don't have any variability there, that's an indication that your sympathetic nervous system and your parasympathetic nervous system are butting heads. That's an indicator that they're not working well together, because each of them, although they sound similar and they're related and they do some things to work together, they also do things differently. Your sympathetic nervous system is what we oftentimes refer to as our flight or fight nervous system. That's where, your adrenaline spikes, your body gets excited, your heart rate goes up. You basically are able to go into action. And that's very important in our survival, and always has been. Even though today we're not necessarily battling wild animals, we still need that flight or fight response to help us out in certain situations. On the opposite side of that, we also need that parasympathetic part of the nervous system, which is basically our rest and relaxation part. Now, that's where we are able to calm down. That's where we're able to digest food. That's where we're able to process the chemicals in our body that help to continue to balance everything else, to remove waste from our body. It's really what we need an awful lot of every day. And when you've got a problem with your heart rate variability, you've got a problem potentially with your sympathetic and your parasympathetic nervous systems fighting. You say, well, Jim, so far, I know nothing and I'm confused. Yeah, I get that. It's the way it seemed for me too when I was researching this. But here's what really happens. If your heart rate variability is way too low, and I mean by that, for me, and I see this sometimes, the heart rate is just like it's 1 second, 1 second, 1 second, 1 second, 1 second, and no variability whatsoever. That's an indicator that those two systems have butted heads, they're locked in, and they're not doing what they should. Therefore, your body is not able to handle situations, and it's particularly can be related to stress. If you're under a lot of stress, if you're very fatigued, if you're very tired, if to an extent you're extremely dehydrated or hungry, which I feel like I live like that. Wait a minute. All those things. But if that's what's going on in your life, that's when these two systems butt heads, and that's when that variability is at a very low rate. For me right now, and I've got some indications on it I'll talk to you about in a minute on my Apple Watch. For me right now, currently, my heart rate variability is at 6 milliseconds, okay? So that means there's only a variable between the two heart rates, or however many are lined up, of about 6 milliseconds. It's just not wide enough. That distance or that time needs to be upwards in the range of, say, 20-ish, 25-ish, 30-ish, in order that your body is set and ready. So your body needs to have, in that case, what seems to be an irregular type of beat, just a little bit of spacing, again milliseconds, but kind of an irregular type of beat. That means your body is setting back. These two systems are kind of just hitting a lick at each other just a little bit, just hey, slow down, speed up, just being calm, just kind of a friendly little punching game. They're standing back. They've not crashed, they've not butted heads, they're just standing back. And one of them is saying, okay, calm down, stay relaxed. The other one's saying, just be ready in case something happens. And it's working together in harmony because of that. If the variability is too small, it means they're deadlocked, and what will happen in that situation is your heart rate will stay high, this variability will stay low, and you'll constantly be on edge, and your stress level, and then this is what matters to me a lot, your ability to handle stress is brought way down. And this is what puts more stress on our bodies. When our bodies can't react, and I've complained about it before, my child or go to do something they're not supposed to do, like touch the hot stove, and I'll react to that to try to save them from being hurt, and I'll get back, and I'll be out of breath, and I'll be just so tired and wore out. Why is that? Because my heart rate variability was so low, I wasn't able to be prepared for that stress. Now, a lot of times athletes, particularly this is being used in athletics today, athletes work really hard to get their heart rate variabilities as high as they can. Again, those 20, 25, 30 ranges, because what that means is their body can relax and it can think and it can rest and it can recover, but it can also be prepared for that fight or flight. It can be prepared for those intense moments. It can be prepared for, doing whatever they're doing in the sport, whether that's, blocking someone or throwing a football or catching the baseball or hitting it off the bat or, whatever it is. It can be prepared for that. In the workplace, same thing. There are going to be things that arise in the workforce where you have to jump into action, do a task quickly versus, sitting back, relaxing, and enjoying the day. And if that heart rate variability is not where it should be, you're going to have difficulty doing that. And that's going to cause problems that go far beyond the heart. Obviously, heart-related, though, blood pressure, the heart rate itself can be off, extreme fatigue, shortness of breath, all these spill-outs. But it can also cause a lot of digestive problems because, again, stress can do that. It can cause problems with your liver, with your kidneys. Basically, every organ in the body eventually can get some fallout from this because it's not being able to have that rest and relaxation point. That parasympathetic nervous system is not working like it should because the sympathetic nervous system is banging heads with it because the heart rate variability is off. Now, in the end of this, or in the beginning of this, I should say, we're now toward the end of it. In the beginning of this, I mentioned morbidity. Or morbidity. That's hard to say. Morbidity. And that has to do with the indication of your survival, of the potential that you may have for death, actually. If a doctor sees in you, and this, please understand me, I'm not a medical doctor, but if a doctor sees in you on your EKGs and when they can specifically measure this HRV, if they say that this is consistently low, and I mean by that, check this day, this day, this day, this day, and it seems every time they check it, any time of day, whether you're at rest, whether you're at exercise, if it is consistently low, then what they assume is that your body is under a tremendous amount of stress, and it's constantly, those two sympathetic systems are banging with one another, they're in a deadlock, and it's really putting so much external or internal pressure on your body. It's putting it under too much stress physically, and it can take days off of your life, actually. It can shorten your lifespan. It can bring up the potential for things like stroke and heart attack can be made higher because your HRV is too low. So you're looking for that higher number, that higher indication number. And again, athletes do this because of it giving them ability and extra ability at times. But every human should be doing this because it really just allowing your body to rest and relax as well as be prepared for fight and flight. So how do I measure my heart rate variability? Well, primarily the most trusted way is I go in and have EKGs done. Secondary to that, and many devices do the same, I happen to have an Apple Watch, and I was just stumbling around one day through the heart health cardiovascular type apps and scrolled down and saw the HRV indication and realized where mine was. And it recommended, at least in the watch, that should be somewhere between 15 and 20, and I'm looking at 6 and thinking, what is it? And so you can measure it that way. How can you help it? And this is what matters even more. What can you do about it? If your heart rate variability is low and consistently low, the number one thing is learning to relax. In my day, we called it chilling. It was chilling. And the best way to do that is by breathing exercises. I don't know if you have ever taken time to do deep breathing exercises, but basically it just means going, and what they would like for you to do to work on that HRV is to breathe about 6 to 8 times per second instead of about 15, which is normal and average. Okay, I meant to say 6 to 8 times per minute. If you're breathing 6 or 8 times per second, you're basically a hummingbird. Do that for a few minutes every day, and you'll watch your HRV numbers begin to go up and up and up. And that means your heart and your body is getting back in sync. It's doing what it ought. And so I look at that. I look at that indicator, and even that annoying app that's also on the Apple Watch, the Breathe app that I once deleted because it seemed so silly, it's back on there, and I'm doing it every time I can. Hopefully you understand this a little bit better. If you don't, then I hope that you'll go watch some of these other complicated videos. Hopefully mine was supposed to be dumbed down, not for your benefit, but for mine, and I don't know that it was, but maybe it was understandable at least. Thank you so much for joining me today. I wish you the very best. I love you, and stay stronger, friends.